Well, welcome back. The message is simple. Early screening can save your life. Colorectal cancer is preventable, but rates are rising in younger adults. Today, we're here with Dr. Neha Patel, a doctor of internal medicine at Nashville General Hospital, and Alicia Fair, who looks at population health research right here in our area. Welcome in.
Thank you. Thank you for having us here today.
Yeah, well, I mean, it's really startling because this is one of the leading causes of cancer-related deaths. So break it down for us. What exactly is colorectal cancer?
Yeah, colorectal cancer is a cancer that can develop in the colon or rectum. It is, like you mentioned, the second leading cause of cancer-related deaths. But unfortunately, it has become the #1 leading cause of death, cancer-related death in younger adults.
Wow. Well, what's causing it? Do we know?
Lots of different factors. There could be genetics, family history. Our diets are definitely not conducive, especially with the processed foods and less fiber.
Right.
And cancer in general can just develop out of the blue as well. So.
Well, the key here is that it's preventable and it's treatable as well. Right. So where does that look like? We have to get screened, right? At what age?
Yeah, absolutely. There's strong evidence to show that screening tests for colorectal cancer can find cancer early enough where it is preventable or treatable. Right now, the screening modalities that we have are colonoscopies that most people have heard about, and then also fecal-based testing where you collect a stool sample and send it in. Screening is currently recommended because of the earlier deaths and younger people being affected by colon cancer. Current guidelines recommend screening starting at age 45 for average risk adults.
And you touched on what a typical screening usually looks like, but you guys have exciting news that was just recently launched. Tell us about it.
Yeah, so there are some barriers to the traditional screening tests, such as colonoscopies and the fecal testing. But the new study, or the new test that we provide through Nashville General, is something called Simple Screen CRC by Freenome. It is a blood test, just like any other blood test that you would do at your doctor's office. There's no preparation required for it. We collect a blood sample, send it to Freenome's clinical lab. We get the results back in 2 weeks, and then we discuss the results with our patients.
Well, and you guys are the first.
Yeah.
We're the first health system in the country. We're really pleased about that, and we're also really happy to have the space to talk about colorectal cancer. And you can see we're wearing blue for colorectal cancer awareness, but also it's something I think that isn't table talk. It isn't something that is natural to talk about, and we really are pleased to have the space to normalize the conversation, to take the fear out of colorectal cancer screening, and that's why the blood test, the Freenome Simple Screen by CRC by Freenome, is important. Like Dr. Patel said, there isn't that preparation that a lot of people hear about for usual colorectal cancer screening. It's blood-based. The results come back in 2 weeks to the doctors. Both Dr. Patel and Dr. Muckle, her counterpart, offer the test to patients. And then if there is a positive, it means there's something signaling in the blood that they may be associated with colorectal cancer risk. If it's a negative, then they continue follow-up as advised by the doctor. So it takes a barrier away for screening, and it brings the conversation forward. We've heard about several celebrities in the news that are young that were diagnosed with colorectal cancer. James Van Der Beek was stage 3. So like Dr. Patel says, if someone detects it early, then it is preventable and treatable at an early stage.
Now, who qualifies for this kind of testing?
So it's anybody that is an average risk. An average risk is considered someone who doesn't have a personal or a family history of colorectal cancer, and they don't have any other factors that may put them at increased risk for that type of cancer.
And what about cost?
Cost. So currently we are providing it as a no-cost early access program.
You heard it, guys. No cost.
Yes. So it's a simple blood test. It's no cost. We're really trying to close that gap and get more people screened so that way we can save more lives.
That's wonderful. And as Alicia mentioned, we're trying to make this a tabletop conversation. You guys have an event, and it's really an educational opportunity for folks out there.
On March 13th, which is next Friday, we are actually going to have our Freenome representatives with us at Nashville General Hospital. And again, to bridge the gap, to talk about this, to normalize the conversation, we will have an inflatable section of a colon, but it helps to, people are different types of learners. Some might want to read a flyer, some will listen to this and learn something. And this inflatable is, will attract attention, but it's important for us to have friction behind any event that we have. What's the takeaway? Learn about the Simple Screen CRC, and we'll have 2 of our research nurses from Nashville General Hospital. Although this is not a research project, it's an early access program, like Dr. Patel said. Shatika and Jenna will be there, able to draw blood from individuals who want to have a Simple Screen CRC test. So, and then it will be available for interpretation 2 weeks after. So learn about it, see the inflatable colon, read the literature from Freenome, come see us, and it's a community event. All are welcome.
That's great. Thank you guys so much for coming in and seeing us and sharing. Get screened. It could truly save your life. Schedule your appointment and learn more about Nashville General Hospital. Find them online at nashvillegeneral.org.